I would now ask for the last speaker to join us. Mr. Shankar is Deputy Director of the Health Management Information System for the Government of Karnataka, and he will share with us, I hope, his experiences, his rich experiences on the Health Management Information System in Karnataka State. You have 10 minutes.
Yeah.
The clock, please.
Good afternoon, dignitaries. At the outset, I thank the organizers for giving me an opportunity to be with you and present Karnataka's HMIS. Anyway, my talk is confined only to HMIS because the topic given to me is HMIS in Karnataka. We have adopted, of course, the national portal of Government of India to register the data. Normally, the software applications will be designed according to the needs of the field. But here, we ourselves have adjusted to the needs of the software. Because it's a national portal, they wanted us to register the data on that portal. I will first give you, of course, in fact, if I want to speak about HMIS, it's a very wide subject. How you design, how you implement it, are you using data, anybody analyzing the data. But here I am speaking, or my talk will confine only to how the Karnataka is utilizing the national portal to send the data every month and what is the progress. As I already told, there is no uniformity across the country. Up to certain level, we have sub-centers, primary health centers, district hospitals, community health centers, taluk level hospitals. Apart from that, still in many states, there are different types of health institutions where we are unable to capture the data on the national portal. So we have done some arrangement how we can capture the data according to the needs of the national portal. This is just a geographical area, anybody can assume. And the arrangement what we have done in Karnataka is, we have different types of institutions just like other states, like sub-centers, PHC is nothing but primary health centers, CHC is community health centers, and then TLH means taluk level hospital. In some states they will call it as sub-district hospitals, and we have district hospitals. Only these things can be captured on the national portal. These are the physical available facilities. Apart from this, we do have other facilities where we are supposed to capture the data. For that, we have created a notional facilities so that the data will not be missed. The corporate and other hospitals is one thing we have created, and urban health centers, and then private hospitals data. The last three what I have mentioned now, corporate and other hospitals, urban health centers, private, it's not a facility-wise data. Even though if it's a facility-wise data, it will be captured from all health institutions, compiled and entered at one point. How the system is working? The sub-center data will come to the PHCs. Under the PHC, the data will get entered. But when we rolled out this HMIS, it was not so. When we rolled out the program, as already the speakers already spoke that it's very difficult. The training program itself is a very, very difficult thing. Because training around some 12,500 to 13,000 people to get the heck of it, that HMIS flow or the technical part of it is a very difficult thing. So we have done the arrangement to get the data entered only at the Taluka health offices. So this data entry at Taluk Health Office till August 2010 we rolled out. Up to June 2011, the data used to get entered like this. But after 2011, that is June 2011, at present, now all the data is entered at PHC level or at the individual facilities except sub-centers. And this private data and the other data and the urban data, that will be consolidated and entered at the Taluka Health Office after consolidation. What are the salient features of this Karnataka's HMIS when compared to other states? Separate user IDs are created up to the PHC level so that the data flow will be very fast. Because earlier, all 300 to 400 individual data to be entered only at the Taluka Health Office. Now, at the PHC level itself, the data will be entered. HMIS program is institutionalized. This is very, very important. In fact, when we start introducing the IT into health system, first they will ask you, give me data entry operator. So we thought, institutionalize it. You give training. In the starting period, it may be very difficult. But in the long run, it will work. Don't go for computer operators. You give training, you see that the people who are regular staff in the PHC themselves will start entering the data. It's working very nicely in Karnataka now. Of course, quality, it's a really big concern. Separate user ID and password created for public, ensuring transparency in the system. Before I started HMIS, many researchers, academicians, students, press people, often and often they used to come to my office. They need data for analysis or for writing some report or for some evaluation work. Now, not even a single person will come. Suppose if they come, we will give the data. Along with that, we will educate them how they can make use of the portal to extract the data. We have created 2 user ID passwords exclusively for public. Anybody at any point of time can download the data. And another speciality of this Karnataka's HMIS is, for each and every health facility, we have latitude, longitude. Because it's a prerequisite for integrating that with GIS application. GIS application is getting ready on one side, and this HMIS or MCTS is on the other side. Now we want to integrate both. This is actually the progress, I think. I don't know whether you can view it. Right from day one, when we started this data entry, 92% of the facilities are entering the data. Today it is around some 97 to 98% of the facilities are uploading the data regularly. I am having the data up to July 2012. Training, we adopted some strategy. In fact, we conduct the training program for the grassroots level workers through SATCOM, that is satellite training. In one shot, I can speak to around some 12,000 ANMs. And for PHC medical officers, I adopted video conferencing. So at the DC offices, my PHC medical officers and the data entry person will come, and up to 4,000 to 5,000 in one day I can reach that PHC medical officers. HMIS data is used for monitoring health programs. Can I have 1 minute?
Yeah, you have 2 minutes.
Okay. One instance I want to tell you, because yesterday I think our secretary was telling about the Transfer Act, the IT initiative. That this time we brought the Transfer Act, and for the transfer policy, the government has announced the number of posts in each and every facility. The association went to the government and asked, why there are 2 posts in that PHC, you have mentioned only 1. So there is no workload, we will not give it. Only 1 post. Immediately he said, if there is any evidence, if the workload is more, you please bring it. Authenticated evidence. Which is the authenticated evidence? HMIS is the only authenticated evidence. If you don't register, yes, you will lose out. What I want to say ultimately is, there is a platform created to showcase your work. Use that platform effectively. Utilize it. You can showcase your work to anybody, anywhere. Just you want to have a computer and web or internet connection. Thank you.
Thank you very much, Mr. Shankar, also for using time wisely.